Hi, my name is Joanne Gill from Dental Directory. Today we're joined by Alif Moosajee, the author of The Smiling Dentist and Principal Dentist at Oakdale Dental. We're going to talk about the importance of getting patient communication right to encourage footfall back into your practices. We'll be taking questions at the end. So if you have any, if you want to message them to me, we're also live streaming on Facebook. But I think for now, let's get started. Alif, do you want to introduce yourselves and tell us a little bit about your experience?
Sure. My name is Alif. Thank you so much for the introduction you gave. I'm a practice principal. I own Oakdale Dental in Leicester. I've been a principal now for about 6 years, and I really actually enjoy that part of my job, which I know a lot of dentists say they don't really enjoy. I'm really lucky. I've got a very, very good team, and we try and look after each other, which I think is key. Been a dentist for about 15, 16 years now. I really like implant dentistry. I'm a big fan of digital dentistry. I teach both of those bits. And I really like education generally. So I set up a study club on the top floor of the practice, and we help to put on courses and the like, clinical and non-clinical, for dentists in the area, so that hopefully we can all benefit and improve standards together. And as you rightly say, I wrote a book. It was about 5 years ago.
Yeah.
Smiling Dentist is a jargon-free clinical textbook for patients. Yeah, and the idea behind it was to try and improve what I call the dental IQ of patients. Yeah. I think that dentists generally make good decisions about treatment. Yeah, and it's actually not that difficult to do. I often say to patients that dentistry is not a dark art, it's not smoke and mirrors, it's actually a very beautiful and logical discipline. We just need to know a little bit about the rules of the game. So if we can educate our patients in the specific bits about the problem they have, they will probably make the same decision that we would make given the knowledge we have. So if that book helps to educate them before I need to do it, so much the better.
That does make perfect sense. I think people who know more about their treatment in language that they can understand, then the decisions that you make seem much more logical.
Beautiful way of saying it has to be in a way they can understand as well, so accessible to them.
Yeah. So even before COVID, a trip to the dentist was, for some people at least, something to be avoided at all costs. How can you encourage patients back into the practice after or during the pandemic that we're currently going through?
I think the key thing is that people's confidence has been knocked a little bit. I mean, that's for everything, isn't it? Go to the supermarket worries some people, just out of the house. And going and having something that's already we know is invasive, there's a potential. Also, this issue with healthcare in general, people are not seeking healthcare because they're worried about who they might come into contact with. So if you can speak to ease the fears or allay the fears that people have, then I think we're onto a winner. So, I mean, having the PPE, having all the rest of it and the protocols in place is one thing, okay? Being able to communicate that eloquently to your patients, to say, we've got you, we've thought about what we're doing, and we wear one of the safest places to come anyway, but we'll continue to be one of the safest places.
So it's about sort of resonating with people in a language that they can understand, really.
Absolutely. That has to be something that they can really hear and understand.
And does that, some patients suffer from dental phobia and anxiety. So what about those patients? Have you seen any of those patients while you've been open?
Oh yeah, absolutely. Anxiety and phobia and just feeling uneasy about dentistry is okay. To some extent is expected, but when it gets to the point where it cripples one, so they're unable to make good decisions and they're unable or unwilling to come to you, then there's a problem here. And what I think we need to do is try and tap into the voice in our patient's head that's giving them this perception of dentistry that seems so bad, it seems so horrible. So one thing I always try to do is to try and build up a picture of why they have that kind of outlook, if you like. Is there a specific thing that's happened in the past that's created that anchor, that feeling that they have? It's little things that have happened throughout. And if I try to meet them and listen very carefully to the language that they use when they're speaking to me, so that I can use the same or similar kind of language back to them, it resonates with them very well.
Yeah.
And you need to know that they've come to somebody who understands them. And I think if they do that, then they suddenly the weight of this fear that they have is almost shed, and they feel happy and almost positive about coming. So I like it. I actually quite like that part of my job where you can really help somebody. I mean, much more than doing a filling or whatever. You can actually change outlook on something that was worrying them and stressing them before.
Okay, so that sort of goes back to what you were talking about with the smiling dentist and the IQ. So you wrote it with the aim of raising patients' dental IQs. Do you think that COVID-19 has made that even more important? Do you think it's more important for patients to be informed about things like PPE and that type of thing?
Yeah, I think so. I mean, as I'm getting older, I realize that there is, I suppose as a younger dentist, I would be so enthused and passionate about what I was doing. I would be telling them everything. And actually, patently, that's unnecessary, massive. I think if we can keep a veil, like a soft focus lens, if you like, on what we're doing, that probably helps a lot. So it's about understanding where we've added value, okay?
Yeah.
So we need to understand everything, okay? And then if we start a conversation and we understand that our patient has a fear about a specific thing, a concern about another thing, then we understand how we have addressed those things and offer those as a conversation, because now that will speak more, it will resonate more with the patient that we have, rather than just say, oh, and by the way, we've got masks, and oh, by the way, we've got this and we've got that, because that was never something that concerned the patient anyway. It's a waste of words, really. So tailoring what we say to that patient, I think, is really important.
And I think, is there any sort of example you can give where you have come across a patient and the language that you've used has put them at ease? Have you got a sort of example of how you might explain something to somebody?
Great. In fact, it happened this week, actually. A patient was telling me about how they have been unhappy with their teeth for a long time, okay? Unhappy enough that it makes them miserable, but not unhappy enough that it motivates them enough to see the dentist. Okay, and then what happened was a front tooth broke. Okay, and now that is the straw that's broken the camel's back. Yeah, that's what we would call leverage. The thing that now makes them take action to come and see me. Okay, when they do, we got into the conversation, and the analogy that they used was, I used to hate the way that my teeth looked, and I say, so how does that feel? How does it make you feel? Well, it'd feel like I was carrying this weight around. Oh, you're carrying a weight? Okay, what, like in a bag? Yeah, in a bag. It was like carrying this weight in a bag. So just tell me, how would it feel if you put that bag down? And suddenly she started smiling. And she's like, my God, this guy is talking to me in terms of the way I view the world. So she mentally put the bag down, okay, and she started opening up about how it would feel if her teeth looked better, if they looked good, looked fine. And so she's into a different flow now. She's in a different place where she's not guarded anymore. She's not reserved, but I'm talking to her in a really nice place. And then I said, right, we need to put that bag down once and for all. Throw it as far away as you can, because we're going to do something about not having to pick that bag up again. And she
And I
was,
suppose if somebody is telling you their story, then they are giving you cues as to the language that you can use in order to replay that story to them to fix it.
precisely.
So you're actually doing a little bit of psychology when you're sitting with your patients.
It's all psychology. Everything is psychology, though. When you're speaking to human beings, and this is a question people ask me, because this is my interest. So people talk to me about this all the time, and they say, "Do you not feel that you're manipulating people?" Now, manipulation is a word for controlling somebody, but I feel for nefarious purposes. Yeah, there's a negative connotation there. Don't feel like I'm manipulating people, because I genuinely feel that I'm trying to work for them, for their best interests. So you say, are you manipulating your child when you make them do their homework? I don't think you are. Yeah, you're doing it because you're trying to look out for them. And I feel like I'm using the tools that I've learned to try and get my patient to do the right thing for them, not the right thing for me. Yeah, and there's a difference there.
So if you're a dentist and you're watching this, what would be the sort of top tips in the language that you are using with your patients that you feel that people could deploy in their practices now to help them improve their patients' dental IQ?
I'd say the key thing is, number one, to listen, and really listen to the language that they're using when they're telling you their story, and make sure there's enough time so that you're not stressed when you're trying to listen to them. Because the right thing to do, in my opinion, is to ask an open question and then shut it. Okay, just listen and listen, and everything that you need to say, you will get the clues for from what they say. And then when you speak, what I would say, you say, right, we need to have a look. You examine well. You do your radiographic examination. You do everything, and don't say anything. Then don't really commit to, oh, we could do this, we could do that. There's no need. You're just muddying the waters. Once you are sure about what you've seen, okay, then you start to talk to them about what their solutions could be. Because I think that any more extra noise at that moment takes away from the gravitas of what you're going to tell them, once you know everything. So if you tell them something wrong and then the radiograph comes back and now you have to, rejig what you're saying, I think it clouds things.
I suppose that's going to remove trust as well.
Yes.
So
yes,
sort of, yeah.
Especially if it's a new patient and it's somebody who is, let's face it, judging you. To see as much as you're judging them, not more probably.
So how do you think that the pandemic has affected dental health over or during the last 3 months when people haven't really been able to get to the dentist? And is that impact going to be felt into the future?
Yes, and yes. So I think that there's been a really negative consequences in oral health. Remember, we've now evolved into a profession of trying to prevent problems, okay? And that's something we've been unable to do for the last 3 months. So prevention regimes have gone, and now we will have to react again to disease that's there. And I am very clear in my mind that I am no way as good a dentist as the big dentist in the sky. Okay, so if I can keep my patients' teeth intact without needing fillings and things like that, I've served them really well. The second I have to pick the drill up and start filling, I've commit them to a lifetime of dentistry, replacing that filling in a few years with a bigger filling, and so on and so forth, as we do root canals and crowns and all the rest on that same too. So this is the opportunity which we've missed, I suppose, in the last 3 months. And yes, I think going forward, we'll have to react, and then we'll also have to take time to speak to our patients again, because remember that when they come to us, dentistry comes to the front of their mind again. That motivation is there to do the right things at home. And if they forget our voice because they haven't seen us for some time, then other things become a priority in that time. So coming back to us, we need to make sure we're again eloquent with the language we use, so we can speak to them in a way that fuels them for the next 3 or 6 months or whatever until they see us again.
Yeah, it does feel as if there has been a sort of missed opportunity to carry on with that sort of treatment, which is sort of telling people to floss or clean between their teeth, and just that sort of gentle reminder, I guess.
Yeah, absolutely. So, reinforcement.
Yeah. In your book, you discuss the importance of making the complex simple so that patients can make more informed choices about the dental care and treatment. So, I mean, you have touched on it a little bit, but just tell me a little bit more about that. So how would you explain something like a root canal, or what you do when you put an implant in to somebody?
So, yeah, I mean, the fact is, what we do, like I say, in dentistry is not really that hugely complicated, especially if we're sanitizing the explanation a little bit, okay? And so, I mean, root canal is a great example, isn't it? There's a nerve in the tooth, and if it becomes infected, we need to clean it out. And if we clean it out, we're left with something hollow, so we need to fill it back in again. But that procedure will weaken our tooth. And so although the biological treatment has been done to alleviate the pain, we'll now need to structurally reinforce the tooth again with a crown. Okay? So if you explain that to a patient, most people are going to understand the principles of what one is doing. So those are little stock things that I've got, which they're just packed in it, really. Implants are the same. We need to put a little false root into your tooth, into the bone, sorry, I beg your pardon, into the bone. And that will anchor in, it will fuse with the bone, and it'll be a really strong platform that will allow us to put a tooth on. Okay? And suddenly someone can build up a picture about what we're saying. So these small things, try and distill the treatment down into the simplest steps so that we can engage with a patient very quickly, a couple of lines, and they understand the kind of thing we're talking about. Because when they understand that it's not crazy complicated stuff and talking about torque levels and access screws and all the rest of it, because you don't need to. It doesn't matter to them really. I mean, I had a thought about this. I don't really know that much about cars. And if I went to the mechanic and then he starts talking to me about all the little nuance of the carburetor and stuff like that, I don't care. As long as my car goes and it doesn't make that hideous sound anymore, I'm happy. So it's not necessary. Unless, of course, a patient asks. And there are those types, and normally the teachers and the engineers, they're the ones that want to know everything, isn't it? So be ready to explain when they ask you, but most people, they don't need it. They just want to know what's in it for them. What's the benefit?
So I know there is quite a lot of jargon in dentistry, and I know that you're not a fan of dental jargon. So is there one bit of dental jargon that really annoys you that you would consign to the bin if you had the opportunity, never to be used in dentistry again?
No, I mean, to be fair, let me rephrase it. I love jargon, okay, in the sense that if we're talking amongst professionals, we need it because it allows us to convey the precision that we need. If I say to my nurse, we need a buccal filling, upper left 7, and we're gonna do that. Sorry. Apologies. And we're going to do that in glass ionomer, then straight away the nurse knows what to chart. And then when she says that back to me next time, we know exactly what we do. So jargon has its place. It just we just don't need to involve that in a conversation with our patients. I suppose that's the thing. And I think I don't know if maybe some dentists feel that, I don't know, they're legitimizing their fee by speaking in this way that is meant to impress their patients. I don't know. I'm not convinced we need to speak in that way with our patients.
I think the way that you just explained root canal and implants was, I think that was a lesson in sort of plain English for dentistry. It was very, very good, and the hand movements were very good as well. Clearly something that you do quite a lot.
I have more for others.
So I think that's all that we've got time for today. So thank you very much for joining us, Alif.
Very well.
And I'm sure that we will be seeing you more in some more videos for DD. And good luck with good luck with the continued opening of your practice. And yeah, it's really good to talk to you. Thank you very much for your time.
Likewise, all the best. Thank you.